Hi, Boulder. I'm City Councilmember Rachel Friend. Thank you for taking the time to stay informed on COVID-19. I want to assure you all that as City Council members, we are reading your emails, we're hearing your voicemails, we're actively listening and gathering information. Please do not hesitate to reach out to us with ideas or concerns. I think if anywhere in the country we could be riding out this pandemic storm, Boulder is one of the best places we could be. As a city and as a state, we are being proactive and aggressively focused on health and safety. Boulder City staff are working around the clock to ensure that our most vulnerable residents are cared for and that the rest of us don't slide into a vulnerable category. Toward that end, we all have a part to play. My husband is an ER doctor, and he's reporting to me that COVID-19 ravages patients' lungs in ways he has never seen in his career. That's why we have to flatten the curve, so that when you or I or our kids, our parents, or neighbors develop these breathing problems, we have doctors and nurses and ventilators available to save our lives. We also need to keep all of our essential workers safe: police officers, grocery clerks, postal carriers, those who work in shelters or group homes. These jobs don't pause, and all of these workers need our protection. Their protection can only come from the rest of us, people who are not working essential jobs, people who stay home. My husband worked an ER shift with a nurse just last weekend, and she's now hospitalized a few days later with COVID. We are asking our healthcare workers to walk towards this dangerous virus every day, and they're bravely rising to the occasion. They have these huge emotional burdens of knowing that they're being exposed to a dangerous pathogen, knowing that they're likely bringing the virus home to family members, not being able to help some patients because there is not yet a cure, and having to tend to a lot of very sick patients all at once. They already have to deal with death as healthcare workers, but the COVID fatality numbers are rising towards a level that will be emotionally crushing. So that's what healthcare workers are being asked to do versus what we are being asked to do, which is stay home. We are being asked to save lives by binge watching TV shows, working in our gardens, hanging out with our kids, dusting off books and puzzles. Friends, this is an occasion we can rise to. We can stay home. That's all we have to do. This is a comparatively easy lift. Please commit to doing your part by protecting each other and especially the essential workers by simply staying home. The safety of our community and the end of the stay-at-home order depends on everyone's ability and willingness to stop the spread. I also want to acknowledge the financial insecurity and increased stress for many who are doing their part by staying home. For those who are fortunate enough to remain financially secure, please look for opportunities to support these local heroes who are dutifully staying at home but cannot make ends meet. If you have any questions about the stay-at-home order or other resources and ideas for ways we can all help, check out our website at bouldercolorado.gov. Also, if anyone is watching this from a home where they are not safe because of abuse or domestic violence, you can access help 24 hours a day by calling SPAN at 303-444-2424. Okay, Boulder, stay safe, stay healthy. We are all in this together, and we'll all get through this together, 6 feet apart.